I just turned it on. Okay. Did anyone go outside today? It's really hot.
There's a parade going on. Not parade, I mean protest, sorry.
Oh, there's a march going on today?
Yeah, it's
From
at the city hall. But I think it's done now.
oh, interesting. Sitting right under a vent. It's very cold.
Hi, everyone. I think we are thinking of just giving it a few more minutes to allow other participants who may be late to join. So if everyone can kindly just wait a few more minutes, and then we will get started shortly. Thank you.
Maybe everyone could check their mic and sound and make sure it's working. And also, are we asking people to use the gallery view or speakers view?
I think right now Andy is spotlighted.
Okay, thank you everyone for patiently waiting. Before we begin, I'd like to explain how to access our interpretation services for this evening's form. At the bottom right of your screen, or towards the bottom, you will see a globe icon with the word interpretation. Please click on this button and select Chinese if you wish to listen to simultaneous interpretation in Mandarin. I will provide 15 seconds at the end to allow for participants who wish to utilize this service to switch over to simultaneous interpretation. If you want to stay and listen in English, you don't have to select anything. We also kindly ask participants to rename their display name to indicate which language they prefer to converse in during the breakout room discussions. For example, you see for my name, I have written ENG Andy to indicate that I will be joining the English breakout group. If you wish to join the Mandarin breakout group, please use MAN.
大家晚上好，欢迎来参加我们今天的国际留学生论坛。是这样的，在今天会议开始之前呢，安迪想先给大家介绍一下我们今天会议采用的同声传译功能。大家打开自己 Zoom 的页面，在右下角会发现有一个地球形状的图标。那么这个图标，如果你是英文版本的，上面应该写着是 interpretation； 如果你是中文版本的，上面应该写的2个字是传译。那么如果等一下你需要中文同步传译功能的话呢，那么就可以点击这个图标，选择中文。那么等一下，嘉宾在进行英文演讲的时候，您就会同步的听到我们的中文翻译。那么如果您不需要这个中文翻译功能的话呢，那么就不需要点击这个图标。另外呢，我们请所有的参与者改一下自己的名字，方便我们等一下将大家按照自己的语言喜好进行分组讨论。比如说，等一会儿，如果您想加入英文讨论小组的话，那么就请在您的名字前面写上大写的 ENG 3个字母，代表 English， 然后破折号加入您的名字。如果您想选择普通话小组的话呢，那麻烦您在名字前面写上 MAN， 就代表 Mandarin， 然后破折号加上您的名字。谢谢大家。
Thank you, Nina, and good evening, everyone. Welcome and thank you for taking time to join our PROTECH International Student Online Forum. My name is Andy Mock. I am one of the co-investigators of the PROTECH project and a member of the planning group for this forum. PROTECH is a community research project developed to address the social impact of COVID-19 on the Chinese Canadian communities in Toronto. At this time, we will move on to our land acknowledgement. With gratitude and respect, our team acknowledges that we are gathered on the sacred land that is covered by Treaty 13, signed with the Mississaugas of the Credit, the Williams Treaty signed with multiple Mississaugas and Chippewa bands. Toronto is in a dish with one spoon territory, which is a treaty between the Anishinaabe, Mississaugas, and Hautestounais that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. We are mindful of the ongoing impact of colonialism, racism, and other forms of social injustice that disproportionately impact Indigenous peoples and racialized communities in Canada and elsewhere. We stand in solidarity to continue our fight against anti-Indigenous, anti-Black, anti-Asian, and all other forms of racism and social oppressions locally and globally. Before we invite our guest speakers, Avvy Go and Dr. Jenny Liu, to present on their respective topics, I'd like to share some information on the purpose and context of our forum this evening. Throughout different community consultations that our project has done over the past few months, many community members have raised concerns about the specific challenges that COVID-19 poses for international students in Canada. That is why we planned this forum as a first step to try and listen to your concerns and begin planning community actions to address them. In planning this forum, we have asked you to sign the registration form about how COVID-19 has impacted your life. From your response, 50% of you have said that COVID-19 caused you medium levels of stress. That was a ranking of 5 or 6 out of 10. And 44% said that it has caused you to have fairly high levels of stress, around 7 to 9 on the 10 scale. In terms of the areas that COVID-19 has affected your life, although most of the areas on the list we provided have some impact, the 5 top areas you picked were concern about infection of people close to me and myself, social connections and social distancing, mental health and well-being, and lastly, education and learning activities. Then they are pretty much equally spread concerns about travel restrictions, access to healthcare and support, and access to employment. We hope through our discussion tonight, you can share your experiences and challenges, stories of your resilience, resources, and support networks that have been helpful to you, and identify some actions and strategies we can work on together to better support each other. Before we go into our breakout groups for discussion, we want to welcome our speakers tonight to share some of the practical information and resources to address some of the concerns we identified so far. If there are no questions at this time, I'd like to welcome our first speaker, Avvy Go, who is the Clinical Director of the Chinese and Southeast Asian Legal Clinic and a founding steering committee member of Color of Poverty, Color of Change.
Thank you very much for having me. 大家好，我今天晚上会用英文去做这个讲题。I also want to start by thanking the organizer for inviting me tonight. I have been told that I'm here to speak about the issues that we see at the clinic faced by international students. Our clinic provides mostly legal services to low-income people from the Chinese and Southeast Asian community. And so the issues that we see at our clinic are probably more related to income issues and employment issue and housing issue, and not so much about the concern about infection, social isolation, and the other issues that Andy have just spoken about. So my apologies to those who want to talk about those other issues that are important to you. I want to provide a context about international students in Canada. They are a very important driver of the Canadian economy. Because of the deregulation of Canadian universities and the decline in funding from both federal and provincial governments over the last 10 or so years, Canadian universities rely heavily on international students to keep their revenue up. Many of the departments, like English department, which is usually not as popular, and have seen a dwindling number of enrollment over the years. Many of them would have been abolished long ago had it not for the revenue generated by international students for the university. And each year, international students bring about $6 billion to Canadian universities just in tuition alone. A study in 2018 shows that international students contribute a total of about $21 billion to the Canadian economy. But even though they contribute so much to our economy, during the COVID-19, while the Canadian economy and Canadian universities are struggling to keep the university and international students around, the Canadian government has not seen fit to provide these students with many of the support that they need during this crisis. So I want to highlight three particular issues that we think particularly for low-income international students. The first is access to employment. The second is access to support. And the third is around their future prospect in Canada. So in terms of access to employment, I'm sure all of you here who are international students know that in general, you can work in Canada on campus without a work permit if you're a full-time post-secondary student in a college or university, if you have a valid study permit and the social insurance number. And some of the students can also work off campus. Sometimes they can do so without a work permit if they meet certain requirements. And I don't want to go through them right now because we don't have a lot of time. And during the COVID-19, campuses have been shut down, and many jobs, both on campus and off campus, have disappeared. So it's difficult even for Canadian permanent residents and citizens who are students to get a job. And what we're seeing is that it is even harder for international students if they need to find a job to stay here, as most of them are more likely to work in service industry, but that industry has been the most hardest hit by the by the pandemic. So number one issue we're seeing is access to employment. The second issue we're seeing is access to support. And I'm sure many of you know the Canadian government has created a number of benefits for people in Canada who have lost their employment due to COVID-19. International students have many problems accessing many of these programs. So for instance, one of the benefits is the Canada Emergency Response Benefit. To qualify, you must have earned at least $5,000 in 2019 or during the last 12 months before you have lost your employment due to COVID. If you're a student who has just arrived in Canada, you would likely not have qualified. And even if you may have come in September 2019, you may not have made enough money to qualify for CERB. The other benefits, that's the Canada Emergency Student Benefit, which is a benefit created specifically for students in post-secondary school, or those who, as well as those who are about to start post-secondary school. That benefit is not available to international students at all because it's only available for Canadian citizens, permanent residents, and protected persons. We are also seeing a lot of students who are local as well as international students. They may be in private rental market. Sometimes they rent a room in a house or a condo owned by their landlord. They share common areas like kitchen and bathroom with the landlord. And as a result, in Ontario, these students are not protected by the Residential Tenancy Act that protect tenants. And so even though we know the Premier has said that no evictions can happen during COVID-19, but because these students are not protected by the Act itself, they are still at risk of being eviction. And we are also seeing sometimes students who want to get out of the lease because the schools are not open, and many are delivering their courses online. But students have signed a lease and they cannot get out of the lease, and they are having difficulties finding tenants to take over the lease. Sometimes students want to go home to the country of origin, but then they are also facing the possibility of not, if they come back, they may have to self-quarantine, they may have difficulties finding housing. So all of those very difficult challenges are facing many students. The final issue I want to talk about is that I know a lot of students choose to come to Canada, particularly from China and other countries, because being a student here allow them a pathway to permanent resident. However, because of the economic downturn brought by COVID-19, we don't know what the Canadian government may do with respect to our immigration policy. So on the one hand, we see the government seems to be relaxing some of the rules to allow, for instance, some agricultural workers access to permanent resident status. And they also have, get rid of some of the red tape for people who need to be landed as an immigrant. So on the one hand, those are the positive things. But on the other hand, we also know from history that whenever there is a downturn in economy, then oftentimes the government will reduce immigration intake in response to rise of xenophobia. So it's very hard to say whether or not COVID-19 will lead to an overall relaxation of our immigration policy that will see more people able to come to Canada and have permanent resident status, or whether Canada will tighten up the requirement to make it harder for international students and other temporary foreign workers to get status in Canada. So those are some of the issues that I think will be facing international students in the coming months and years. Thank you.
Thank you, Avvy. So I will now open the floor up for questions for Avvy. I think the best option of getting questions is if anyone wants to message, either you can use the chat function, or if they wish to use a reaction, a thumbs up perhaps, that indicates they want to speak. I guess I will start off with a question for you, Avvy. I'm wondering if you've heard anything about how students will be able to come back or access courses that are in a hybrid mode. Some information has been released by certain universities saying that they will offer a combination of in-person, hybrid, or distance education. How do you believe that will impact these students who are looking at either returning or not returning at this point?
Yeah, so I think it really depends on the university and the college. And I do know that some are, for instance, Seneca College, I know is looking at the hybrid model. I don't know whether U of T and other York University are doing that or not. I think if it's a hybrid model, then I think the students would have no choice to come back here, right? Because if they have to attend some of the classes in person, then they will have to, come back to Canada. And I think that, I think as it seems like the trend is for reopening, even in Ontario. So I think that maybe there is a chance that we will see more of the hybrid model.
Thank you.
I sent another question, Andy.
Oh, so we have another question is, have you run into cases where people are not able to get their biometrics to complete their work permit renewal requirement and then may risk losing their permission to work and access to healthcare coverage?
I personally have not, but I have seen other clinics talking about this thing. And I understand that during this time, the IRCC is going to let people to apply for renewal, even if they may not be able to get the biometrics complete. So my advice is that you should, if you need to submit your work permit renewal application, you should do that even if you may not be able to complete all of the process right now. So in terms of the healthcare coverage, so I'm assuming students have their own sort of healthcare coverage through the universities, correct? I don't know about the requirements as to whether some of these healthcare coverage would relax the rule around biometrics. So I think that's something that the students may have to talk to the university about. But for sure, ILCC is currently relaxing a number of rules. So you should renew if you need to.
That's great. By extension, I received another question to ask you. How will this impact their international students' travel? Do you anticipate with these rules being changed consistently by the government, whether they will have a harder time potentially coming back? Or do you think they will have to stay overseas and continue to wait before they can figure out what their next steps are?
Yeah, so I have no idea what's going to happen. I think there, the one thing that I think that people need to think about is that a number of, experts are talking about the possibility of a second wave. So I don't know if we have a second wave, whether, for instance, whether our government will lock down the border to make it impossible for people to come back, right? Because right now, if we're all doing our jobs, supposedly we will, be able to reopen, and if we do so cautiously, more and more things will open. But if we are hit with a second wave, all these experts' comments that I have seen are pointing to that there will be even tougher lockdown if there's a second wave. So, but I have no idea. I can't predict the future, and certainly I don't know how the government will react, and whether they will actually lock down the border completely.
Great. Do we have any other questions? Just going through to see if there's any thumbs up or any other questions. I guess before we wrap up, perhaps if you want to share, what kind of services are you able to offer students, international students, for example, and what might be a good way for them to get in touch with you if they need to access some resource and service from you?
Right. So as I explained earlier, we provide legal services. We are a legal clinic. So we could only deal with like your legal matters, such as if you have an immigration matter, or you have a problem with your landlord, that sort of thing. And we only provide services to low-income people. And we also limit our service to those who face linguistic barrier. So if you are fluent in English, chances are we will refer you to the local clinic where you live, right? So, so those are some of the criteria that we use in providing services. If you do meet our qualification and you do have a legal question, then I encourage you to call us at 416-971-9674. And if you're calling from outside of Toronto, the number is 1-844-971-9674. And I encourage you to also go to our website, csalc.ca, where you can find a lot of the COVID-related information in different languages, and also information about employment, housing, immigration, and so on in different languages as well.
Thank you. I have one additional question a participant just sent to me. What do you constitute or your clinic constitute as low income standard? Is there a threshold?
Yeah, we do. And what we will do is when people call us, we will do income assessment. We'll ask some basic questions. So basically, usually when the person call, we will just try to answer the question without asking about their income. However, if we think this is a matter that requires our representation, that we need to be retained as their counsel, then we'll do an income assessment. We'll ask about the family size, source of income, family income, and so on and so forth.
Perfect. Thank you so much, Avvy, for being here tonight and for providing such valuable insights.
Bye-bye.
We really appreciate your time.
Yeah.
Thank you again. Now I'd like to welcome our next speaker, Dr. Jenny Liu. Jenny is a postdoctoral research fellow at Toronto Western Hospital, the University Health Network, and at Ryerson University within the Daphne Cockwell School of Nursing. Dr. Liu is a creator and lead author of the multi-system model of resilience and will discuss how to promote mental health and resilience in our daily lives.
Thank you, Andy. So hi everyone. Good evening. 大家好，我叫 Jenny. I will be giving my presentation today in English because my Mandarin is not so good. But if we get some Q&A, I will try my best to answer them as well. So as Andy already introduced, I am a postdoctoral fellow at Toronto Western Hospital. And what I do is because I focus on research, so I do a lot of health promotion research in different populations. And for my doctoral studies, I started looking at resiliency. So what is resilience? Well, it's really actually an engineering term that refers to the elasticity of any structure. So for example, if you're building a bridge, you want to be able to assess, how much weight can come down on the bridge before it crumbles, right? So it's really about how well a structure, the structural integrity of something can hold up. But we refer to resilience every day in terms of how we can cope with stress, how we can bounce back from different events. So in fact, our resilience will look quite a bit different compared to a bridge because we are human beings and we have so many different factors and environments that interact or that influence our everyday experiences. So why did I study resilience? It's actually because of a bunch of personal experiences. For example, during my doctoral studies, I encountered a little bit of a harassment from a practicum site supervisor. So this was actually another fellow student who I was supposed to work with at the time. And he developed a little bit of cyber stalking tendencies, and as a result was harassing me, and it became a very, very stressful experience for me. And at that time, it was really affecting my personal life, and I was actually fearful also for my physical safety. And at the same time, my supervisor at the time wasn't very supportive either. So all of these things, factored together, and I really felt like I was ready to crumble, like I was that bridge that was about to go down. But actually, there were so many services that were offered to me to help me out once I voiced my concern, once I started speaking out about my experiences. So what happened was I first shared it with another supervisor, what was happening to me, and they started seeking legal services for me to protect myself They provided me with a lot of social support, a lot of words of encouragement. And I went from thinking I was going to quit school to, bouncing back of sorts. But my experience is actually not really that unique. In fact, we all experience things in our life. So I want to see if you can just physically put your hands up, I can see them. So how many of you have ever experienced the stress in your life? Lots, right? So, and how many of you are here now? It's a tricky question. You're all here, and you're all here because you're resilient. And that's something I really want to emphasize, right? Is that we encounter a lot of things because we are evolving beings. We can have a bad grade on an assignment, we can fail a class or even a term or a year. We can have our funding withdrawn, we can have our paperwork stalled, we can have visas expiring. All of these things happen because that's life, and life is up and down, but we're all here and we're all resilient because we've all had to be, and we've all had the capacity to become resilient based on our experiences here so far. So what is resilience when it comes to humans? It's really a process. And what I mean by that is I want to break down this process a little bit further. Our resiliency comes from different resources. We draw it from within ourselves. We can draw it from our health and health-related behaviors, like how well we can regulate our emotions, how well we can stop ourselves from getting angry, or having a structured routine of going to sleep and getting well rested, eating healthy. Those are some of the health-related behaviors that can help with our internal resilience. We also get our resilience from the experiences that we have. Perhaps from going through the cyber stalking events, I've learned to be more vigilant. And from our past experiences, from our educational experiences, we learn and pick up skills and tools along the way, and that helps us as we cope with more stress in the future. So we get our resilience from our interactions, from our experiences. So that's another way that we get our resilience. And last but not least, a large part of our resilience comes from things that are external to us, right? So something that Avvy talked about earlier, how we are able to navigate social resources, how well we can access healthcare, whether or not we have access to legal services. Those also importantly determine our resiliency. And you as international students are positioned in a way where, although some people that in your community might have access to certain services, sometimes you may not receive the same amount of access, and that might create some challenges for you. So we can think of all of these processes that contribute to our resiliency, but we can also think about the stressors that drain it. For example, we can't always be resilient all the time if we're worried about where we're going to sleep at night, right? If we don't have food, if we don't have stable shelter, we're not really, thinking about how well we can bounce back from different challenges. And if we, have a stable, secure shelter and food, then we might think about, well, how well can we grow from our experiences? Well, what's next in our life? So those are some of the things that we also encounter. Those are needs related to self-development, to growth. And then something like a pandemic happens, and all of a sudden these things that we never think of are challenging our resilience. We're worried about what happens to our status. We're worried about what happens to the classes that start in the fall semester. These are situational and unpredictable things that also influence our resiliency. So I want us to think about the fact that our resiliency doesn't just depend on us, but it's a process, and it's something that we can source from different areas of our lives, but that also can be drained based on our experiences and challenges that we encounter. So we're not resilient or not resilient in one context or another. And in fact, we are all resilient all of the time. Just our container of resilience might be different. Some days we might feel a little bit drained and depleted because we used up a lot of our resiliency to deal with a challenge. And another day we could have, restore some of that resiliency by having a casual conversation with your friends or your family at home, and that replenish some of your emotional reserve. Other things happen, and they will continue to happen. But what's the most important thing is us understanding that our resiliency is a process. And as we experience things, as we learn things, as we become exposed to different experiences in our lives, we have the capacity to increase our resilience container. Will we be resilient all of the time? No. But what we can do is better understand where we're sourcing our resiliency from, what's draining it, and then appropriately manage it in a way where if we're low in one area, let's replenish that area. So the next time we need it, it'll be a full container. You're not draining on empty gas tank. So that's really the model that I developed, is about understanding, okay, where is our resiliency coming from? Where is it high? Where is it low? And what can we do about it? And that's something that I'm really excited to share with you today. So if I may share my screen, I would like to share our PROTECH website, which has a pretty cool resiliency tool that you can use. Is that okay with everyone? All right. So here's the screen, and I noticed that we do have a lot of English speaking. So what I'm going to do is convert our site back to English. What's really cool about our PROTECH website is that it is multilingual. So we do have English, we have Chinese simplified and Chinese traditional. Everything is translated in these texts. So this is a resilience assessment tool. It's like a neat little personality quiz, if you will, that you can take. There are 27 questions. And of these 27 questions, once you answer them, you will be able to get a very tailored report back in terms of how you're doing right now in your resiliency, where you're really high in, where you're really low in. And then once you really understand that, you can treat it like a map, and you can really use it then to improve the areas that you might be lower in. And as I said, because our resilience is really like a process, we need to do this periodically to see, okay, what are we not aware of that might need some replenishing? Where are we doing really good in? And assess our strengths and our limitations. So I just quickly did it, but when you do it, it should take you no more than 5 minutes or so. And what you will get is a pretty cool breakdown of your overall resilience scores. Where you're really high in, where you're really low. And when you go to the low parts, you'll get tips about how to improve your resilience and where you can improve that further. So periodically, it would be good to evaluate yourself, and I highly recommend that we visit our website to do that at projectprotech.ca. What's also cool is that we have this in a form of a digital application. So it's called MSMR, or Multi-System Resilience. So if you find that you don't want to go on the website all the time, or that you want to, start a yoga class or start some mindfulness exercises, and you want to track how that's doing for your resiliency over the period of a month or two, what you can do is create your own account and track your resiliency score on this app right here. So I'll share the app, and it has its own website as well. It's msmrtool.com, and I'll put it in the actual chat box as well. So taking away from all of this is that we will encounter unexpected challenges in life, and we will continue to encounter challenges, but we're all resilient. And as we encounter things like racism, changes in your status, or changes in life, understand that we are growing beings, and we will continue to find ways to be resilient. And once we understand what is needed, that offers a point of change where we can pivot and we can develop that where we're lacking resiliency in, and make sure that we can grow it some more. So it's not that we're resilient or we're not. Sometimes we can't help the circumstances we're in or the stressors that come up. But what we can do is pivot ourselves and make sure that we increase our container of resiliency as much as we can. Thank you.
Thank you, Jenny. So at this time, I'm going to open up questions for Jenny. If anyone is interested, they can either chat and message me, or to everyone, or if you wish to ask her question directly, you can send a reaction and I will call on you. Let's see if there's anyone. I guess I can start off with one, just to kind of get everything rolling. Thank you for that, Jenny. Have you found your model to be useful in addressing the type of stressors and resilience that people have been working through over COVID? Have you found it to be, applicable in that sense? And have you received any feedback about how people may perhaps apply to their daily lives?
Mm-hmm. So a lot of times we really think of ourselves, and we really define ourselves in a way where we think, oh, I'm really not very good with stress. I don't really deal very well with pressure. I'm very anxious. And we don't think about sometimes all the things that contribute to our state at that point. We don't live in a bubble. We're not isolated beings, and in fact all of our behaviors are affected by our interactions, right? And sometimes if it were not for being able to access legal services, if it were not for supportive friends, family, and mentor to get me through my personal experiences, I would not be thinking, wow, I really overcame that challenge. Instead, I would be thinking, wow, that really wore me out, and that really made me really stressed. But in fact, once we contextualize and really understand what is stressing us out, is it really because it's a COVID and it's a pandemic, or is it because as a result of the pandemic, I am losing some economic opportunities? I am uncertain about my future, and I don't know about whether or not I'll have a job when I graduate, and what that means for my own life and my own goals. So once we are really able to position those things, we can really then start addressing them, because you can't address a problem unless you're really fully aware of where that's starting.
Great, thank you. Do we have any other questions from the participants?
I think Linson had his hand up.
Oh, okay. Yes, Linson, thank you.
Okay, so I actually have a question, because actually before I came to Canada, resilience was never I think professional or academic term that's in our life, or I'm totally not familiar with it. So I was just wondering, how does it relate to international students, specifically when it comes to dealing with a lot of mental health issues? What are some of the resources that they can have access to, for example, like especially in at the campus, because even though all these universities have already put up a lot of good programs to focus on the mental health issues, but whenever there is any tragedy happens, people always point their fingers at school. So I was just wondering, just in campus, is there any resources that can be conducive to building up your own resilience?
So multi-part question. So I'll try to start with the first part, which is what happens if this term is really not that familiar to international students. So resiliency, in fact, is not a commonly used term in the Chinese language. In fact, I tried to get my own mom to translate my model and my measure, and she said, never heard of it, don't know what it is. But we have different idioms for resiliency in different languages and in different cultures. So for example, we can colloquially maybe think about it as 抗压力 or 抗毅力, right? Which is really just our ability to tackle or resist stress. And we can think of similar idioms in other languages, in other culture, but the idea of resiliency, of this process of overcoming challenges and our way of overcoming that, whether it's relying on ourselves, relying on others, or relying on a combination of the mixture, that process is universal. So to understand that is we might have certain language barriers that prevent or stigmatize certain things like discussions of mental health, but we all encounter these challenges and we all have a way of coping. With regard to specifically mental health services and things like that on different campuses, that's quite specific to different universities, I would say. For example, certain universities or certain colleges have made their services more available even during the pandemic versus those that have not. But as I mentioned earlier, when we think of resiliency, some of the resilience that are external to us, we don't have to find it from just one source. If there are no specific services about mental health that suits you or that is offered at a local campus, there are other resources available. We have lots of mental health self-help tools, if you will, on our website. There are also other community organizations that are more culturally sensitive, which can become a very important factor in understanding our mental health. So I highly encourage you to visit our website, first of all, check out the resources, but also see that because mental health is not a one-size-fits-all, see what works for you and explore and find different ways. And of course, we also offer a live chat service Tuesday to Saturday, 11 to 4, and Wednesday evenings at 6:30 to 9. I'm sorry, I'm plugging all of our services, but we are able to also, as live chat, offer you tips, emotional support, some important resources and information that you might find helpful.
Thank you so much, Jenny. I actually have another question. So this question, I actually experienced it a lot with all my friends who came here as international students, and then they had to encounter, job hunting after graduation or, at the third or fourth year. So how would you kind of, apply the concept of resilience in a situation where you have a friend who is like so disappointed or so upset about not getting any job interviews or not being successful in any of the job hunting activities, and how can you kind of direct them to kind of think about that they actually have the resilience that they built up? So So this is more practical because I do see a lot of friends having this kind of concern, and I really want to help them. So I believe the concept of resilience is going to be a good starting point.
Yeah, absolutely. And this is actually a great story point as well, because it's a concern that's shared by so many, myself included, because after postdoc, I'll eventually have to find a more permanent job. So the idea of the different types of needs is, while some may be experiencing, needs related to their essential security and well-being, such as, shelter and stable sources of food and things like that. Others' needs are more related to personal growth and goals and aspirations, and it may be very closely tied to their values of, who they believe they are, their goals in life and things like that. And those needs are just as valid as, say, need for shelter, and they're just as valid as, needs that might arise as a result of a pandemic. So so to understand that and to, bring them into the conversation is to recognize that resilience is multifaceted, it's multidimensional. And while they may be struggling with specifically their resiliency related to their personal growth, they might be rich in resources and resiliency elsewhere. So it's a good starting point to destigmatize certainly the conversation by focusing on their strengths, but then also help them, shift focus. So I would encourage you, maybe have a conversation with your friend, have them try the quiz, and maybe they can see where all of their strengths are, and that helps put things into perspective as well.
Perfect. Thank you so much, Jenny.
No problem.
Great. Do we have any other questions for Jenny? Anyone else? I'm just trying to go through the gallery. Nope. Okay. Well, if that's the case, thank you so much, Jenny, for sharing your research in the Resilience app with all of us. We really appreciate it. If there are no additional questions at this time for Jenny, we will move into our breakout group discussions, which will be from now 7 o'clock till 7:40. So we'll have roughly 40 minutes for the breakout rooms. Each breakout room will have one facilitator and some note takers. 10 minutes before we resume back to our bigger group, everyone will receive a notification. So at that point, please start trying to wrap up. If there are no questions, I will ask Nina to kindly have everyone go into their breakout groups.
Okay, thank you very much, Andy. I'm now gonna stop the interpretation function for now, and then we'll 把那个 I will turn on interpretation.
Okay. We're just recalling, I think the English group is still oh, Shirley's back from the English group, but I think some others are still coming back. It takes full 60 seconds to to come back forcibly. So if they're still halfway through, yeah, everyone's here now.
Great. Welcome back, everyone. And as mentioned, the interpretation services are now available again. So if anyone needs to utilize the interpretation service, please press below. I guess now that we're back in the main group, if perhaps I kindly invite the Mandarin breakout group, if anyone from there would like to just share some of, in a very short, concise way, what were some of the primary challenges and what were some areas of collective action that you envision moving forward to better support everyone. I don't know if anyone would like to take a lead on that from the Mandarin breakout group. Jenny?
Sorry, I actually turned on my interpretation to see what it was like. And then I didn't, and I missed your entire thing. Would you mind repeating?
Oh, yes, no problem. I was saying that if anyone would like to, from the Mandarin breakout group, to kind of report back to everyone on some of the main areas of concern, some challenges, and also actions that you talked about collectively as to where we can better support people or what we can do moving forward as a group. Are you going to be leading that, Jenny?
Who's the facilitator and recorder for that group?
I believe Min Hui was a facilitator and Linson and Susan were the note takers.
So one of them should be reporting?
Yes.
So I think mostly it would be most helpful to focus on what do people think that PROTECH as a group or this particular group can do together to move to the next step, right? Because we want this to be the beginning of the planning. So if there is action that you think that we should follow up on, then we could highlight those.
Okay, it's Linson here. I can report back some of the items that's been discussed. Can you guys all hear me?
But we can't see you, so just having a. Okay.
Can you guys all hear me?
Yes.
Yes, we can't see you though.
Yeah, because my roommate's at the background walking here and there. So, okay. So I think one of the issues that's brought up was one member mentioned something. He said that he or she mentioned that when he was walking on the street, sometimes when he or she witnessed some kind of discrimination incidents, and he or she doesn't really know what to do and how to like whether he or she should intervene or how he or she can intervene. And those are some of the I guess some of the practice or some of the knowledge that we kind of need to make sure that we understand, and by making sure that we're in a safe environment, but at the same time stand up for injustice or stand up for discriminatory actions is something that we were discussing. And then I think it would be helpful if PROTECH can provide more guidance regarding how people can react to those situations.
Any specific things about international students that people think we should be working on?
Yeah, may I add another point? So a lot of members of our group mentioned that they feel physically and a little bit also mentally isolated during this lockdown. And although they can have they can have like FaceTime or other ways of communication with their friends and family, they still feel like stay with themselves indoor is a challenge. So I think kind of practical advice to the PROTECH team is whether we could hold any like regular online sessions for people to catch up with each other and to have some communication, just to let everyone know that they are not alone, and they are like there's a group of people, a group of international students are facing this challenge together. And also, if this kind of regular session could have some, for example, mental health or legal professionals to have brief Q&A and to answer their questions, that will be really helpful.
Great, thank you. Susan, you were also note-taking. Did you have anything you perhaps want to chime in?
Yes, I do have one little detail, is that in terms of anti-Asian racism and international students' perspective, we're thinking that maybe like, for example, as international student, you're new to Canada, maybe your English is not that fluent to respond to discriminations. And you are not familiar with the laws and regulation in Canada. You don't know what to do. You don't even know, can you talk back or can you even fight back with any like verbal or physical discrimination against you or your loved ones. So that might be a little bit of topic that maybe we can add in the future for international student town halls, I guess. Yes.
Great, thank you so much. And then I guess if there's no, Jaden just said something in the chat. She says, in our Mandarin group, we shared about racism issues and upcoming workshops from legal clinics. So if anyone's interested, there is a link that's been provided. That's great, thank you so much for that, Jaden. If there's nothing else more to be reported back from the Mandarin group, I kindly invite Kai to report from our English group.
Hi, everyone. So yeah, I think there was definitely a lot of overlap, or at least in some variations. Sorry, the host has spotlighted. Oh, great. So I think there was definitely overlap in terms of some of the themes that were discussed in the Mandarin group as well. But we kind of focused a lot on like how everyone experienced and went through the process of like essentially the fear of infection of either themselves or those around them. And so everyone shared you know, personally how, actually it was kind of interesting thread concerning, and folks who were from Hong Kong kind of shared how, like, you know, they were cognizant of how serious this was going to be and that they were kind of more alert about it at the beginning, but then they heard from some of their like more maybe domestic counterparts here that people were saying they're overreacting or that like this wasn't a serious issue yet. So that was, I think, one of the main pieces that came out of that discussion. We also talked a bit about like the different types of medical masks and usages, but like that was a bit of a side tangent. And then, yeah, we also, like one thing that also like came up for us was the topic of anti-Asian racism specifically. Like people share personal experiences about, you know, getting weird looks in them and when they're out and about when they're wearing masks, but that's kind of dulled down now as well since everyone else around has started wearing it. But then just like overall, we had this concern that like this anti-Asian racism specifically is getting entrenched really early and really quickly without people really noticing it. So for example, someone being told, like being called or COVID from a child, for example. So it's kind of this thing where it's like, it's becoming normalized. So there's a concern of that. But overall, it seems like everyone thinks that like now that protocols with respect to like hand washing, social distancing has become more normalized, the fear of transmission has dulled a bit, but still like for themselves, but the concern for transmission to others still remains their main concern. With respect to the different initiatives or like collective action we can do, again, a bit of an overlap in our group, we wanted to see kind of like, again, this mobilization of international students to start doing more self-advocacy. It seems like there's been some work being done already, but people are finding that like, it doesn't seem like everyone, international students necessarily have the skill for self-advocacy or to do this mobilization in a large group. And so there is work right now wanting to see international students essentially demand transparency for tuition fees and how that's being broken down, because as I'm sure everyone knows, international students are being charged a ridiculous amount of money. And so, folks are rightfully trying to ask for justifications from their faculty. And so what some folks have suggested is, drafting a petition, or like, there is a petition that has been drafted, but getting more folks to sign on about that and to mobilize and to promote would be really important. And then collaboration with not just international students, but domestic students as well. Then we also talked about, as other collective action, is just doing potentially like creating some sort of information packages for international students who might be stuck, or like maybe common issues that other folks are experiencing. Because one of the issues that came up was international students being stuck where they're at their home countries maybe, and then not being able to come back to Canada to restart their studies. So maybe doing some sort of like information package or accessible information that allows folks to know who they can talk to. That would be really important. And also just maybe collective support at a community level. So like maybe folks were saying how, it kind of takes like an individual, like one-on-one relationship to like support someone. Like, you have to know someone to ask for help, but there isn't like I guess like a bank or a collective kind of like group of people who are actively doing all this, like kind of running errands or like getting groceries for other folks like that. So maybe we could see something like that happen. So I think that sums things up. Andy, if there's anything that I've missed, please feel free to.
No, I think you covered everything. As Kai mentioned, the biggest ones were advocacy, collective action, and information package. And I think Minhui talked about that too. So not just legal mental health services, but how to navigate and use healthcare systems, insurance issues, and resources for students who need immigration support. If they're not in Canada right now, who do they call in Canada to support them? So I think Kai, you did a great job covering most of those. Did anyone else from our English group have anything else they would like to contribute at this point, just to wrap up? I'm looking at the chats. Alan, anything you would like to add to wrap up?
So, what I've heard, I think both groups talked about, I think there's like 4 big areas that there is quite a lot of interest and need that maybe we can work together as a community. One is the area of more practical knowledge and skills into how we respond to racism in everyday settings, especially. So the event from CCNC and Cultural Link and Legal Clinic sounds like a great start. I'm not sure if it will have enough time to go into all those details. I think when people talk about the everyday examples, it probably can use a lot of input from young people and our lived experiences to think of, interesting strategies. Oh, sorry. I forget that we are translating. Okay, so yeah, so I think like 4 areas that I've heard that we can probably do more work on. One is skills and strategies in responding to racism. One is about reducing isolation and increasing support, either through online or other forum for international students. The third area is developing some better organized resources and information to support people to access help and services. And, not just in Canada, but also if they are stuck elsewhere in their country of origin or something. And then the last area is advocacy, about tuition fees, about immigration and visa processing policies and flexibilities and related things like that. Does that sound like it captured the key areas that people have been talking about?
I think that sums it up really nicely. Thank you, Alan.
So I think
I'm also just,
yeah. So I guess like one of the purpose of this forum is to really try to gather more people who are international students to work together on doing more planning. So if we can maybe have people express whether they think, you know, those are some of the areas that we can work together on and organizing future activities on. That would be helpful. Andy?
for sure. I guess there's a few ways of going about this. One, if people wish to connect via social media, if anyone has, what's the best way? How many people we have here right now? 20 people. So if everyone provides consent, we can send an email out to everyone, and that way you can connect with individuals who may want to take on a project. By extension, once you've exchanged numbers, you can either make a Facebook group, a WhatsApp group, WeChat group, and just to explore some of those options as to how you can move forward. And then if you need support from the other PROTECH members or people from this event or the working group, that's great. Another option, as Jenny mentioned, is to connect through social media directly on the PROTECH website, which is a great option as well. We do have a PROTECH project WeChat group, Facebook group, Twitter, and Instagram, which Jenny has kindly posted in our chat. So that's one avenue. And I think that's what we typically have done in past working groups and events where people and stakeholders got involved and found, you know, different areas where they're interested in. So I do suggest that. How does everyone feel about this? Yes, perhaps, yes. Maybe if we can cancel the spotlight and then go to part gallery view, we can maybe see.
David had your hand up, right?
Davin?
Davin?
Oh, sorry, Davin, you're on mute. You have to unmute yourself. Sorry. Nope, still muted. I can unmute
okay.
you.
Hello.
Yes.
Hello. I was responding to the chat message. It says to raise a hand to create a working group and stay connected. Yeah, and I think that's a good plan.
Okay. Would anyone here? I guess you can just chat me privately. If anyone has any objections and don't want to be part of this, I will exclude your email. But otherwise, I will just send an email to everyone and then we can take it from there if that's okay with everyone. Any objections?
Or maybe do the thumbs up again one time. Because
if everyone's okay, yeah. Press thumbs up if you're okay being part of a working group. I'll give it some time. Let me see if I can capture anyone who does not agree. This is like a video game. Hiroshi, you're good. Okay. I guess Wendy and Irene and Lucia would you like to join?
No, Wendy's good.
Wendy's good. Irene and Lucia, would you like to join? Because it keeps going on and off, so I'm just trying to follow along here.
Okay.
Yeah, Lucia's okay.
Actually,
Irene,
sorry.
would you?
Sorry,
Yep.
I have a friend who just left left before the breakout room. So if she wants to join this group, can I just like tell her as well?
Yes. You know what? I think that's a great idea. Jenny also proposed if I'm going to send everyone a follow-up email, and if you'd like to participate, just email me back. And then if you have additional friends who would also like to join that weren't able to attend today, just have them give them my email or forward them my email to you and then have them reply back to me and I'll include everyone. I think that might be an easier logistics way.
Yes.
Sounds good. Alrighty, so I'm just being mindful of the time. It's 6 minutes past 8. Thank you everyone so much. I especially want to thank our translators. You've had to put up with our fast speaking, and bless your soul and thank you kindly for your support. And I also want to thank all of the participants here. I hope that this was helpful in some way. I hope that this will be the beginning of a long working group relationship and journey where we can support other people in our community and international students. And as Jenny mentioned, please visit and utilize our PROTECH project if you need any support. Take care, everyone.
Bye-bye.
So I'm gonna stop recording.
Okay.
Yes, you can stop recording.